Good morning, everyone. Thank you so much for joining us in the University of Warwick Masters in Public Health and Health Promotion. We're delighted to have so many colleagues and interested students on the programme with us this morning. And just a running order for today is that we will be talking to Dr. Sadaf Lyons first, who is one of our excellent tutors on the programme. And then we'll be talking to one of our students, Dr. Mohammed Amin Hureshi, who's in Saudi Arabia and is participating in the course right now. So delighted to have both of them here with us today. Just to give you a little bit of an overview of Dr. Sadaf, she is an international associate. She is a consultant with the International Association of National Public Health Institutes. And she is I suppose she is an expert at public health strengthening and transformation expert and passionate about public health and patient-centred healthcare. She's worked extensively in the United Kingdom and the Middle East, leading multicultural and international teams, and is a member of the UK Public Health Faculty and the Royal Society of Public Health. And she's just wonderful to have, and a contributor and a subject matter expert to our modules as well, and delighted to have her here with us today. So Diarmuid will talk to her first, and then our student who's participating on the programme, Dr. Mohammed. And then Diarmuid will give us a full overview of the programme, programmatic overview. And during that time, just to let you know, we will cover a lot of the frequently asked questions about tuition fees, the time commitment, the start dates, the curriculum, and the general questions that most people do answer, and local recognition. And if you have any other questions, though, please put them into the chat, and we'd be delighted. And we have many of our team members here today just to answer your questions as the webinar progresses. So I'm going to hand you over to Diarmuid and Sadaf first.
Brilliant. Thanks so much, Rebecca. Great to see everyone this morning. Sadaf, if I start kind of following Rebecca's intro, why did you choose a career in public health? What made you go down this particular journey?
Thank you, Dermot, and thank you, Rebecca, for that wonderful introduction. So my background is actually in health systems and health system strengthening. That's where I started my career. And the more that I worked across in the provider sector and also with governmental organizations in terms of developing national programs around health system strengthening, it became very clear to me that most of the health gains are to be had within public health. And so when my shift from that moment on started into public health itself, and so a lot of the models of care that I was designing had an element of preventative health within that and health promotion, and initiated that. Really started my journey within public health. Obviously, then you start on your academic journey and learning, which is why the students are here today. And that really then shifted me into moving full-time into public health itself, because I could see very clearly with the financial inefficiencies and clinical inefficiencies within the curative model, the natural focus should be on how do we prevent people from getting diseases and from being sick in the first place. So that really was the reason why I moved into public health. And
there's any number of kind of threads to unpick in that, but the one that stands out is health promotion. And I think that's where, as you say, the curative model is, it's reactive. By its very nature, it's reactive. It's waiting for a problem to manifest. Whereas if you look at preventing disease, obviously you get a better quality of life for your population, but also the burden on the health system isn't as much. And one of the things I think people are often curious about with this program is it is a Master's of Public Health, but we've put an emphasis on health promotion. Other public health masters will have an emphasis on epidemiology or on infectious disease, etc. Yeah. Why do you think it's important that we've put the emphasis in our MPH on health promotion?
Well, I think that's a really important question, and it's a choice with the public health students around what their interest actually is in. But if you look at health promotion, I think any contemporary public health organization or focus has a huge element of health promotion within that. very simply for the reason that 80% of health gains are to be had through behavioral, lifestyle, prevention aspects rather than tackling the actual disease. We can see, I mean, whether it's through COVID or TB, HIV, or anything else, there are huge, not only costs, but there's also huge programmatic work that needs to be done in actually controlling and curing those diseases. So I think, you know, if you're looking at behavioral changes, lifestyle changes, informed choices that people make around their health and well-being, that is very much targeted towards the health promotion element.
Absolutely. And, you know, on one of our other masters in diabetes, you know, yes, we focus on treatment, obviously, but if you can get the self-management piece right, if you can get patient empowerment, if you can get diet and lifestyle and exercise, and if you can influence all of those things, then the complications which befall somebody are not as serious and don't have as much of a burden on the health system. So, you know, in both communicable and non-communicable diseases, the emphasis should be on ensuring that you prevent as much of this as possible. And quite a bit of that, as you say, is down to the promotional health aspect of nudge theory and influence. And I think it is a hugely important part of where public health is going. And to respond to some of the questions that are coming in, I mean, Sadaf, careers in public health. And again, I think this is where public health, unlike other disciplines in healthcare, there's a very broad base of people that come into public health, and similarly, then they branch out into a reasonably broad range of careers. Where I think everyone would accept that a master's in public health is it's the currency that you talk in for public health. It's what everybody has. But where can it bring somebody?
Okay, so if we link it to the conversation we're just having around health promotion and public health itself, the broadness in terms of career development. So one of the aspects that the students will learn through this program is around not only individual personal choice, but also around things like social determinants of health, those the environments that we live in, environmental health, climate change, all of these issues that impact health itself, and how health promotion can help in that. The reason why I'm, talking about this is that that translates then into different careers that somebody with a Master's of Public Health can enter into. When you're doing healthcare or clinical, then you go into the provider sector because that's mostly where you work. When you do public health, there is from the community level up to national level roles and international roles, which encompasses all of these areas. So you can do some work within environmental health, you can work within food industries, you can work within, local councils to improve people's environments and communities. So it's huge. Or you can lead on national screening programs for early intervention and prevention models. So there's a lot of different career options for people who undertake a master's in public health.
And the kind of final question to explore, this is an international program. So we've taken a curriculum, it's mapped to the Faculty of Public Health in the UK, but it's very much got an international flavor to it. Obviously you're in UAE, Mohammed that's with us is in Saudi. What do you think are the benefits of having an international mix of students on a group, and B, an interprofessional mix within the class that you're teaching today?
Yeah, I mean, I love my group of students. They come from Malaysia, UAE, Saudi, they come from different professional backgrounds. One of the things that a kind of multidisciplinary or multi-professional group brings is the avoidance of having groupthink. Yeah. And, with groupthink, you have people from the same country, the same models of, programs. And so you just repeat the same ideas, you duplicate, you're not exploring new perspectives. Whereas when you have a group that we have at the moment, where you have doctors there and you have dietitians there, somebody from a completely different background, psychologist, all of those different things, the richness in the discussion and the richness in actually thinking and having some critical thinking around concepts and different subject matters, the students gain a lot. I gain a lot as well, because I can, see what the influences are and what different situations are in terms of the burden of disease. So we have very, very rich conversations. And I think that's the real value of having an international program.
I completely agree. And I think it's really, really important that while you're getting a UK qualification from the University of Warwick, the experience, because of the way we structure the groups and because of the way we structure the teaching, the experience should feel contextually relevant to wherever you are. And I think I think it's really important that it's not just a UK curriculum transplanted and delivered, say, in Saudi Arabia or in Malaysia, that it's taking the best of what the UK curriculum has to offer and then making it relevant for an international audience. I think that's extraordinarily important. Let's go to Mohammed. Let's go to, the end user in all this. And the person arguably that matters the most is the person at the receiving end of the education. Mohammed, you are, in fairness, you are about 4 or 5 weeks in at this stage into the program. Initial thoughts, how are you finding it?
Thank you, Diamond. Thank you, Dr. Sada, for your presentation. Thank you, Rebecca. And hello, everybody. Well, so far, I am, to summarize, I am really satisfied of what I have received as information, as contact with the other classmates, with also my tutor, Dr. Sada. The first thing that I have that caught me to get to specifically this program is all the variety of the courses and the title, health promotion within the public health. So I explored the program, the courses, the flow of the courses. Everything was fitting my expectations. So that's it.
Brilliant. And how are you finding balancing your professional life, your family life, and study? How has that adjustment gone?
Well, I was conscious this would be a challenge, especially that I am working a lot. I'm working in clinical research, and I am having different research projects in the different specialties. I have to say this is a little bit challenging because it is, in terms of time management, it may be a little bit difficult to manage between going back to studies after having several years of professional life, besides the social life. I have children, I'm married, I have children. But the opportunity of the Warwick IHID program is that, first of all, when it is internet-based and self-paced learning, this is really a great advantage for me. I would not be able to do it otherwise. So this was really an option that was critical for me. The other thing is the tutorial sessions that enable a weekly, let's say, checkpoint of what you have learned, and you see that you are in the correct direction. So this is really important to me. It gives confidence, and it guides you through the most important let's say notions and aspects to explore. So this is, in terms of gain of time, it is really efficient.
And I you've hit on a couple of really interesting points there. And I think one is there's always an adjustment period when people start onto a master's program. And what we would find is that in module 1, everyone is very much finding out, well, how much do I need to do and how much do I need to read and how long will it take me to do this? And then by modules 2 and 3 and 4, 5, 6, they've got a really clear ability to know what the expectation is, to know how much time and when. And as you say, I think the bit about the tutorials is key, because it does a couple of things. One, it brings all the content together for that week. It brings that week's topic to life. It synthesizes and summarizes it, but it also allows you to have the conversation with your peers around it. And the other bit that I think that does is it makes you feel like you're not on the journey alone, that you're in a group of 20, that you're having discussions with peers. And I think all of the benefit that you get of an online internet-based program, what we've been very careful to do is make sure that you don't lose the support structures that you would have if you were going into a physical building with people. So having the weekly tutorial session, having the discussion forum, the fact that you get to know your tutor well, that you get to know Clodagh if she's on your tutorials, having all of those interpersonal connections, I think is really, really important. How have you found the platform actually? How have you found the online experience?
Well, the online, yes. First of all, I agree with what you said. I agree with what you said regarding the tutorials. I was just talking about the aspect of the gain of time, but also in the human contact and the confidence it gives you within the group. Well, about the platform, it really reflects I give you my spontaneous remarks. It really reflects the program expected when reading your program in the PDF that I have received before registration. So it really reflects the flow of the courses. You have a progress a bar showing you how much courses you had. In the dashboard, it's user friendly. It gives you interactive material, which is intellectually challenging, and also it gives, let's say, automatic feedback of what you to test your own knowledge. So it stimulates curiosity. Sometimes it's, let's say, you have fun doing it. It's not burdensome. You see, I'm working in two, let's say, heavy or a professional word, reading reading articles.
It shouldn't feel
heavy, but this,
it shouldn't feel dense or heavy. It should feel the content, an awful lot of work has gone into making the content accessible, visually interesting, interactive, and all of those things you've described. And I think that is extraordinarily important, that if you have the desire to immerse yourself in a subject area, then the obligation that we have is to make that experience interesting, is to make you want to engage with it more, to make you want to read more, to make you want to explore it more. And particularly on an online program, that means the quality of the online experience has to be absolutely top rate. And, I think one of the things that I'll touch on in my presentation is this program has been designed to be online from the outset. The very DNA of it is this is an online offering, as opposed to this was a campus-based course that because of COVID is now delivered online. And I think there's a subtlety there that means everything that we have designed within this program is for someone that's in exactly your situation, that has, a young family, that has a busy professional life and is doing a master's at the same time. And it's very much, the master's program has to fit in with all of those other things, because none of those are going to drop away. So if it doesn't manage to fit in with that, then it doesn't work. So an awful lot of energy has gone into making sure that the delivery model and the experience that you have is an enjoyable one.
It is enjoyable.
And
It's really,
you know,
it really
and that
differs. What I was saying is that it really differs from a material which is heavy and which we are accustomed to. This
hmm.
is really a different experience, which gives you the pleasure in reading, in exploring. So it really is. It really is.
And that's it's so brilliant to hear that, because what that says to us is that, you know, when you're into, you know, module 4 or module 5, that if we keep up that level of engagement and enthusiasm as we go through the program, the success that you'll have will be a great one. So, you know, it's very important to keep people motivated as they go through. So no, that's wonderful. Mohammed, I'm conscious, I Sadaf knows this, I could stay here and chat with people all day about the program, but I'm conscious of time, we're coming up on the half hour. Is there any advice you would give to somebody who is considering coming onto the program?
The question is to Dr. Sadaf or to me?
Say to you, Mohammed, first.
Okay. Okay. Yes. Well, maybe I can go back in time and see my first steps before I get to the program. I was looking for a program for in healthcare, a master's of health public health and health promotion since several years. Online, this was my criteria because given my situation. And also to cover the most of the dimensions that I was wanting to be covered. I found out since the first weeks, let's say, that public health that there is a big gap in my training as a physician, in understanding and considering the public health issues. This is what I was really amazed to and pleased to get through the first weeks, is that it changed my view for the understanding of the issues of the public health issues, and to consider these more. Since I am working in clinical research, it goes well with the evidence-based approaches. Yeah. And also, as said Dr. Sadaf, in terms of health gains, I do not believe we could achieve best or better health gains other than working in public health. I really advise the future, let's say, candidates to consider that public health, maybe they are from different backgrounds than mine, but considering the public health is to consider the future because it is also in line with the sustainable development. It is in line with the critical thinking of a global vision of healthcare, of the society, like I said, Dr. Sadaf, also for the social determinants, behaviors. So it is really important to consider these approaches, and the let's say the opportunity that your program gives is to open all these perspectives to us as and enable a real shift in our thinking, in our perspectives. So
fantastic. No, Mohammed, and thank you so much. I think, you know, I will shortly go through all of the program overview and the structure and everything else, but I think it's incredibly compelling to hear from somebody who's actually on the program. And the bit that resonated for me there was actually it's having relevance, it's having impact, it's changing how you're viewing your current work. And that, you know, forgetting the assessment of the program, forgetting the qualification you get at the end, that is the ultimate litmus test of, you know, is a program doing what it should? Sadaf, any final thoughts for any advice you would give someone considering coming on the program?
I think Mohammed Amin has really covered it very well from a student's perspective. But I do think, people who are coming onto the program have to appreciate that this is a different way of thinking when you're looking at public health as opposed to other disciplines. So, it will change the way that people approach health and well-being within a wider population base rather than a very individual patient focused or, smaller group. So I think you have to immerse yourself in the materials. You have to be prepared to make that commitment as well. And Dermot, before you move on, just 2 questions I can see in the chat that I just want to address. Yeah. One person has asked about the job prospects in the United Kingdom after pursuing a master's in public health. As you know, we already spoke about, there are huge opportunities that are available, but I wouldn't like students to think about, okay, so if I'm doing an MPH and I want to work in the UK, I have to work for the UK Health Security Agency or Public Health Wales or that. There's, local authorities hire directors and managers of public health, as well as international development work as well, which most of these public health organizations support. It's the same in the Middle East as well. I suppose pre-COVID, COVID has changed a lot in terms of the way that people perceive public health now. And there was much more focus on healthcare and healthcare providers. 97% of all the funding went towards it. But with COVID now, it's really opened up not only the understanding of public health in itself, but also in relation to the interface between public health, healthcare, climate change, and all of these different aspects. So, students should think really broadly around where the career can be developed from this.
Yeah, I think you're absolutely right. I think there has never been more of a spotlight on the role of public health, certainly within that vertical. But as we said at the start, it branches into so many areas that people can go into. So, Sadaf and Mohammed Amin, thank you so much for your time this morning. I am very conscious that you're both back online in an hour and a half for an actual tutorial session. So look, it's been fantastic. I think there's nothing quite like the perspective of a learner and of a facilitator on the program to give people a sense of what it's like. And I think the bit that comes across to me from both of you is that there's an actual warmth there. You've gotten to know each other. And I think that, as an education journey, that's incredibly important as well. So, right, thank you very much. What I'm going to do now, everyone, is thanks, Mohammed. I'm going to share screen, and hopefully you can all see my screen now. And what I'm intending to do over the next 25 to 30 minutes is to go through the structure and the overview of the program and give you all the detail. I think we've heard what the program feels like. So what I'm going to do now is give you all the details to how it's, what it covers and how, and eligibility and fees and everything like that. So one of the things that you'll notice about the program is you'll notice IHEED sitting alongside the University of Warwick all the time. And Warwick needs less of an introduction, but IHEED, we are an Irish company. We're founded by a general practitioner in 2013. We're a division of the Cambridge Education Group in the UK. And small people. We effectively, what we do is online postgraduate education, and particularly in the healthcare vertical. We don't do any other type of work. We've done an immense amount of work across the Middle East with the Saudi Commission, with Hamad Medical Corporation in Qatar, with the Ministry of Health, with KIMS in Kuwait, with the Dubai Health Authority, And really, a lot of what we're doing is developing capacity within health systems. And that's very much in the spirit of what we're talking about this morning is, enabling health systems to have the capacity and the expertise to manage their population's health. So we have across our everything from CPD programs to master's qualifications to family medicine residency programs, we've had over 400,000 course completions on our online environment since 2013. So what we do by partnering with the University of Warwick is we bring a very prestigious qualification from Warwick to a global audience and do it in a way that is an extremely compelling and interesting online experience. Warwick, as I said, need far less of an introduction. They are ranked 8th in the United Kingdom. They're one of the UK's top universities. They're ranked 62nd in the world. Their campus-based Masters of Public Health is ranked 3rd in the UK. It's ranked 12th globally. So Warwick are an absolute powerhouse in public health. They have a phenomenal reputation in public health research and education. So what is important is that this program is accredited in the exact same way as any other University of Warwick program. The certificate that you get at the end of this program, the award, is the same as any other Warwick award. It is simply a Masters of Public Health and Health Promotion. It does not mention distance learning. It does not mention online learning. It does not mention IHEED. It has the exact same standing as any other qualification that they offer. There is no difference between them. So in terms of the overview of the program, what we're trying to do is academic excellence is absolutely at the heart of this program, and you will be steeped in the latest research and thinking in public health, delivered by an absolute world-class team of experts. And as Mohammed Amin has said, provided to you in a really, really compelling online environment. So, it will be an enjoyable, immersive, interesting experience, and one that's hugely supported as we go through. The program content, so it is a University of Warwick award, but the actual content has been written and authored by a broad team of experts, and this is simply some of the people that are involved in the program. And you've got people like Katie Reid, who directed Manchester's MPH for about 12 years. Tim is with the British Medical Journal. Ulrich is a well-known figure in public health with the Federation of Public Health Associations, GM Piero, etc. So you're getting a very, very broad perspective. And then what's really important is when it comes to the tutoring aspect. So, we've people like Sadaf, we've people like Prof. Issam from Beirut. We've got Samina, who's based in Qatar. We've got people in Malaysia, in Melbourne. So your faculty on the program is as diverse as the population coming onto the program. So to Sadaf's earlier point, what we don't have is one small homogenous, very UK English experience. It will feel like an international program, but one which is based on a curriculum that is coming from the very best of what UK public health thinking has to offer. So all of the modules in the program, we've mapped the contents to the Faculty of Public Health syllabus, and really, there's 3 semesters, and the first semester is the postgraduate certificate level, and it has 3 modules in it, and each module has 6 weeks of content. And really, we call this semester the basic sciences. And actually, Sadaf, do you want to talk through the kind of the approach or the flow through the first semester?
Yeah, sure. So the first semester is really providing an overarching overview of everything that the students will be covering then in subsequent modules. So the first is, I would call it a taster of the deep dive to come in the other modules. So when you're looking at public population and personal health, it's really just introducing what do we mean by public health. You're talking more about how do you develop the evidence, what does environmental health mean in terms of human health, and then you move into, you know, the other areas which touch on the health promotional aspects in terms of public health policy development and public health action. So by module 1, the end of module 1, students will have a very good idea of what public health means and what topics there are, the main topics related to public health, and what they will be studying then or going into in the other modules.
Yeah, and I think what you get in semester 1 is kind of the science of, well, you get the introduction, and then, you know, how does data help us in looking at public health? How can policy help transform the health of populations? And, you know, it's very much setting the scene for what's to come in the second modules, which in the second semester, which the following 6 months then looks at areas around, you know, and we've spoken about the importance of health promotion and of understanding how change happens and understanding how to communicate these. The international health and sustainable development, again, this is looking at some really, really contemporary areas in public health thinking. So looking at climate change, looking at major events, looking at mental health, looking at nutrition and food and healthy cities. So, you know, across modules 4 and 5, I think you really get into the absolute most contemporary areas of public health. Module 6 then is, it's really important that as your career in public health develops, that you are empowered to have the conversations around financing, around how organizations work, around team dynamics, around financial management, so that when you are at a boardroom table and you are trying to influence that, you have the more macro understanding as to how issues of health policy, economics, financial management, budget setting, how all of those impact on the arena of public health, and really how professionals collaborate together interprofessionally to, you know, uncover problems and build interventions and make improvements. So is that a fair summation as to where semester 2 brings people?
Yeah, absolutely. And to your point around health economics, I think, you know, when you work within a science and evidence-based environment, it's very easy to forget that the decision makers are looking at things from a completely different perspective.
Yeah.
They're looking at it from affordability, they're looking at it from choices. If you make one choice for a program, you have to take away from another program. So what this actually provides the tools, not only around the science and the evidence, but it's also about the presentation, how you present it to the decision makers, and how you make a compelling case.
And I think it's fascinating that within this module, one of the assessment points is to do exactly that. It's to make a case for something and to be persuasive and understand, as you say, that, you know, the recipient of what you're trying to persuade someone to do, you know, they may not or will not be a public health advocate. They will have largely an economic hat on, and as you say, the resources will be constrained. There will be competing interests, and it's about how all those things balance out. So our course leader, John Fletcher, he would say that, you know, this second semester is very much the art of public health, because you know, you learn the basic sciences, and this then it's into an art form, and it is into how you actually engage people, how you persuade people to do things, and how you deliver. And that's across, I think, all of the modules in the second semester. Is very much you're going away from kind of very hard science into lots of gray areas where there'll be multiple correct options, multiple competing factors, and you know, you only have to look at some of the big public health strategies that are different across different countries to realize that it's all about having the ability to adapt things to your context. But as a public health professional, then your job very much comes into play in module 6. So you need to understand how what as best practice in public health can fit with the situation you find yourself in. And really it's about, in that context, it's about leadership. When we get into semester 3 then, so the first 2 modules are 6 months long each. When we get into semester 3, we're very much looking at research in public health. And this is where you do a professional project in an area of public health that interests you, and bring that right through. You can see the taught component of the module here, which is 8 weeks long, which is effectively guiding you towards the conception and then the execution and the writing up of a research project. And Warwick, I think, are, they're very innovative in how they assess the research piece. It's not a 15,000 word thesis, which sits lonely on a shelf. It is, the output of this is a 4,000 word journal article and a conference poster presentation. So you should walk away from your master's with the ability to submit the work that you have done into a journal, to present it at a conference. And that's something quite tangible, it's something quite useful, and it further enhances your CV. And public health professionals, they're at the forefront of research across, within, as Mohammed Amin is, within clinical research across, healthcare practices, non-profits, community organizations, higher education, government, private industry. So looping back to the question at the start about, what are my career options? I think particularly in the area of research and public health, it is endless as to where this can bring you as a career. So it's not that there is a single career trajectory towards being a public health consultant. There is a myriad options for you. So that's what the program covers. In terms of how it covers it then, and as we said at the start, this is an online program that's been designed to be online from the outset. So we give you a really comprehensive online orientation to make sure that you are fully comfortable with everything, that all the supports that are available for the program, how it works, where to find things, how to use the online platform, ever before you start module 1, week 1. And then each week follows a rhythm. So we'll have a case-based discussion about a particular topic. So if we're on the Communicable Disease Week, at the start of the week, we would have given a case study on communicable diseases. That would have been discussed back and forth online on a chat forum between SADAF and her students. And then while that discussion is happening, the people on the program are going through the online content in their own time. And these are just screenshots of some of the content, but it speaks to what Mohammed Amin was saying about the accessibility of the program and how flexible it is, and just it's an enjoyable experience. There's lots of video, there's lots of animation, it's very interactive. Anything that you can see here that looks as if it might be clickable is, and it really, it does not feel like you're reading flat text. It does not feel like you're reading kind of very dry information. And it's not PDFs or PowerPoints. It's really high-end content. So you go through your discussion forum, you go through your content during the week, and then at the end of the week, so at what, 2 or 3 o'clock this afternoon in UAE, Sadaf, you deliver the weekly tutorial.
Yes,
and
it's
Sadaf,
3 o'clock UAE time. Yeah,
3 o'clock UAE time, and
yeah.
There's multiple groups in parallel, so there's lots of different tutorial times available depending on what suits somebody. But Sadaf, what do you use that weekly tutorial for? So you have an hour with your learners every week.
Yes.
They've gone through the online content. They have the theory in the background and the didactic piece. What do you use the tutorial for?
Well, what I don't use it for is a repetition of the materials that they've been through. because taking into consideration that we have about an hour and a quarter, what I like to do is use that for interactive discussion based on the materials. So I will do a kind of very brief recap emphasizing the points that they should remember from the week's materials, but then I use case studies to present and then open it up for discussion to say, okay, so if this happens, there's an outbreak, for example, or there's a high air pollution index rate in a country, what would you do? Then how would you approach this? How would you develop it? So it's really, really interactive. It provides an opportunity for the students to also present their own data or evidence, or from their own countries as well, and then we can open it up to a bit of discussion. So making sure that that is interactive is of primary importance during that tutorial session.
And the other thing you've hit on there, and I think it's within the assessment as well, is trying to make it feel authentic, that there's a real life application. And in the assessments of the program, while it is, obviously as an academic program, we have to have assessment in it, but the types of assessment that we're asking people to do, I think, are very authentic. They're going to present a scenario to you, and they're going to say, in line with best practice and what the evidence says, what would you do in this given scenario? And I think, again, that makes the program really accessible. There is one examination in the program, and people usually have a very strong reaction to the word examination, but there is one examination in module 2, which is covering off epidemiology and statistics and evidence bases. What I would stress is, for anyone who's perhaps nervous about statistics in particular, the focus on module 2 is very much the interpretation of data, not the creation of it. So it's saying, if you see a confidence interval, what does this mean? If you see this data, what does that do for the number needed to treat? If you see, if you see a forest plot, can you discern what it means? So it's very much, in module 2, it's very, very much about interpreting data that you will come across. And, God knows you don't need to be in public health to have come across public health data in the last year and a half. It's how do you interpret what the CDC in the US are putting out, or the WHO are putting out, and what does it mean? So the focus on the assessment is very much all along the way. It's a very applied assessment. So in terms then, that's kind of an overview of the program, of what its features are, what it does. What it feels like as a learner then is, you're in small groups, first of all. So at the moment, we have 3 groups of 20, and we have limits on the group sizes. We have limits on our tutor to student ratio. So the program has a cap, and it was oversubscribed on the last intake. We expect the next intake to be oversubscribed as well. But it means there is a closeness between the tutor and their group, and the group all get to know each other really well. The timing, the pace of the 6-week taught modules is, we have refined that extremely well to say, we think we've hit just the perfect balance of people being able to manage it within their professional and family lives, and having this slot in neatly around that. So the commitment wise, you should be able to manage this with your clinical or your professional workload. And there's a huge amount of support available on the program. We've got the program leaders on the program. We've got the tutors who are massively invested and engaged. You'll meet someone from your course management team every week. There's technical support people there as well. And it's the model that we use is an executive master's, which is a very high level of one-to-one support given to people. In terms of the experience and what it feels like, so our Warwick programs, we've put well over 500 people at this stage, probably from more than 36 countries as well, over the last couple of years. We've 96% engagement on the programs, and the latter two statistics there are from a survey of this program that we did last week, where we asked people at the midpoint in their first module to say, right, how have you found the initial part of the program? How have you found the support, the organization? On the basis of that, would you recommend this? And we get incredibly strong feedback from the participants. And again, I took a selection of quotes from that survey, and what they're speaking to me is what Mohammed Amin spoke to earlier, which is the dedication of the tutors, the quality of the materials, the level of organization is really, really strong. So in terms of then eligibility and how to join, so the eligibility for Warwick for this program is an honours bachelor degree granted by a recognised institution. So effectively a university degree is what we're looking for. It should be not necessarily the degree in an area, but you're obviously going to be working in an area that's in some way related to public health. You do need to be able to complete the program through English. There are essays. You do need to be able to write comfortably in English, and obviously to understand the program as it's delivered. However, you're not traveling to the UK. You do not need a Tier 4 visa, and therefore we don't require you to have a formal IELTS assessment to come on the program. So what we do ask you for in the application process is a copy of your degree transcript, a personal statement of 500 words. Again, that helps us with the English piece. An employer or an academic reference to say that you're a professional in good standing, and photo ID. So it's a really, really simple, straightforward online application process. You get responded to incredibly quickly. The point I made about group sizes is valid. The program fills up, and it fills up very quickly. So fees very straightforward. It's £12,000 for the Master of Science. It's £8,000 for the postgraduate diploma. There are, as you can see there are very significant discounts available if you register early on, and if you choose a more upfront payment model. They are time bound, so 17th of December is the first registration deadline that the university has. But if you pay your deposit and register in the program in advance of that date, you can get, as you see, quite considerable discounts off the course fee. So when you're on the program, then you can pay by semester, you can pay by month, obviously you can pay up front as well. And for anyone in the UK, it is eligible for student finance funding in England and in Wales. So there's a lot of flexibility in how you pay. There's, if you are interested in the program, and bearing in mind it was oversubscribed last time and is likely to be again, there are very clear incentives to registering early and very real benefit from doing that. So I'm going to finish up very briefly now, or very shortly now, get on to any questions from chat. So, what you're getting from the program, the University of Warwick is an amazingly prestigious institution, top 10 in the UK consistently, top 60 worldwide consistently. This fits with there are many career paths out of public health, but it does fit with the academic requirement for public health consultant training, along with a lot of other paths you could take. It's very, very good preparation if you're interested in the Faculty of Public Health exams. I think there's then a number of transferable skills around critical appraisal, around research, around analysis, around being able to synthesize data and interrogate it and not wait for somebody else to interpret it for you. So you're getting, you're getting a very unique blend of research, inquiry. You're bringing people together from across different disciplines to really explore how can you make a population's health better? How can you prevent disease? How can you structure health systems in society such that they are progressing and improving all the time? So what we're looking at then in summary is a 22-month master's program that's made up of 6 months for a postgraduate certificate, 6 months for a postgraduate diploma, and then 10 months for an MSc. The next intake is in March of 2022. It will fill up, it will be oversubscribed. The award from Warwick is a phenomenal one. The program is recognized worldwide. You will get, as well as the academic award, you'll get CPD recognition. The extent of that varies depending on the country you're in. If you're in Qatar, they'll give you 36 hours per academic year. If you are in UAE, they'll give you 96 hours if you're in Abu Dhabi. DHA gives something slightly different. So the amount of CPD you get varies depending on your health regulator. But I think what is important is the program is designed from the outset to be innovative, to be a really compelling online experience. It's very hard to get the sense of fun and enjoyment across on a webinar like this, but the participants are, you can see from their statistics of the surveys they fill out, they're loving it. They have a really, really positive experience on the program, and it is fun, it is enjoyable, and it should deepen your interest in public health and in engaging in this area, which can have just such a positive impact on health systems. So I'll stop share there. Rebecca, I'm not seeing a lot on chat, but if there's any questions that people have following the presentation, we're very happy to answer them now. So,
sorry, my unmute was acting up there. No, I think we've answered. There wasn't that quiet enough today. Some days they're extremely chatty, other days it's quite quiet. So I think we've answered most of the questions today. I just want to reiterate a few points that actually there is the amount of CME in the kingdom.
Good question. Don't know off the top of my head is the honest answer. We will happily look into it. We deal with the Saudi Commission a lot, but yeah, CME recognition, I'm not sure. We'll get an answer for you, Nazia. It's probably the easiest thing to do.
And Noor has their hand up so if you want to put your question in chat, Noor, that would be preferable if that's okay with you. But yeah, as Dermot said, Nazia, we work very closely with the Saudi Commission on multiple projects and have a close alignment in terms of the CME, so we will get an update on that for you. And we work with them on blended learning family medicine programs in 3 family medicine academies in the kingdom. So very close partnership with the Saudi Commission, and we can just let you know what the CME is. To see if there's any more questions. Just to reiterate, as Dermot said, that we do have different tutorials for different time zones, and what that means is we do cap each region. So after you reach a particular cap, it's usually 30, actually between 20 and 30 per time zone, we cut that section off. So places are filling fast, deposits are coming in quite quickly. So if you are interested in the forthcoming March intake, I would recommend that you go ahead and apply and pay deposit as soon as possible. And just to let you know that you will be getting the recording of this event and the application link and the deposit link in an email later today. But you will also get a reach out from one of our education advisors. They're usually calling you from a UK number. So if you see a UK number that you don't recognize, it will be one of our staff. So you please pick up if you can, and they can talk to you in detail about the program, in a lot more detail, and answer any questions that you don't feel were answered today. And they're happy to help you. They're extremely knowledgeable, so they're there to answer any questions that you have.
And Noor has asked a really good question, Rebecca, which is just give a bit more clarity about what the weekly commitment looks like and what the time looks like. So I've brought this slide back up. So on a Sunday, we will eat. So each week has a topic. So let's go back to module 1. So module 1 has 6 weeks of topics: understanding public population health, global burden of disease, environmental health. You then have a reading week, a break between the 2 sets of 3, and then you come back for 3 more weeks. So, and each week has a topic. So let's just use the current week that we're in at the moment, which is Communicable Disease Control. So as an example, and every week follows the same pattern then. So on Sunday of last week, we put up a case study on communicable diseases, and that will take somebody about, by the time they read the case study, have a think about it, read some materials and contribute to it online, that will take them about an hour to do, but they can do that whenever they want during the week. They will then be going through the online platform in their own time during the week. Each week there is approximately an hour to an hour and a half of reading of just the core materials in the contents. And then on a Friday afternoon, if you're in Sadaf's group, if you're in one of the other groups, it can be on a Friday morning or a Thursday evening, you come together for your tutorial, which is an hour to an hour and a half. So in any week, there's a very structured kind of 3 to 5 hours of time where you're studying, where you're reading materials, but only 1 hour of that is where you need to be at a particular place at a time, and that's your live tutorial with your tutor. So the live tutorial is the only time of the week that you actually need to say, okay, I know that on a Friday morning at 2 o'clock or 3 o'clock or 10 a.m., whatever your tutorial time is, I know I need to be available for that hour. The rest of it you can do in your own time. Naturally then, as you come up to prepare for your assessments, you'll be studying more, you'll be reading more, and you'll be writing. But the weekly rhythm that you should be able to fall into is what a lot of people do is they will dedicate, they'll pick 1 or 2 evenings in the week, or they'll pick an evening and a weekend morning, and they'll say, that's the time where I'm going to go and lock myself away, and my family know that I'm studying, and that it doesn't bleed into every aspect of your life. So very manageable with your other commitments. And the tutorial is the only specific time you need to be available for during the week. They are all recorded. You can watch them back afterwards, but as Sadaf has very eloquently highlighted, they are interactive, they're discursive. It's if you're not there live, obviously you miss the benefit of that interaction. So yeah.
From there, just Dermot, about from Felipe, the content different with the campus curriculum, very much so, Felipe. This content and this whole curriculum was created in 2021, and we have quite significant emphasis on health promotion. And I suppose we cover really exciting aspects like healthy cities, mental health, and just it is extremely contemporary. And I'm sure Dermot can talk with a lot more.
Yeah, so I think it's fair to say that the semester 1 content of the basic sciences is probably pretty familiar across both, or pretty similar across both. Both programs will cover health policy. They'll both cover an overall introduction. They'll both cover they'll both cover epidemiology and statistics to a similar degree. Where these programs then start to diverge a bit in terms of content coverage is our second semester, where we look at international health, where we look at areas like healthy cities and nutrition, etc. And that is just a different pathway. I think what is important is the Warwick course director of the MPH that they have on campus. Saran is the course director for this MPH. So it's the same leadership team within Warwick overseeing both programs, the campus-based and this program. So yes, there absolutely are content differences, but very deliberately so. And it's reflecting the fact that this is a new program and that this program has a particular focus on health promotion. QCHP, yes, QCHP accept this. They give it CPD and they recognize it in Qatar. Sorry, Matthias, same question there. Payments, yeah. So payments, you can pay on a monthly basis, you can pay on a semester basis. if you are able, you can also pay up front if you choose. So there's lots of different payment options available to you. And I think what is important actually is the current population of the program is approximately a third from Europe, UK, Ireland, and within that group there's a smattering of people from Africa and South Africa. Then there are the largest populations actually from the GCC and from the Middle East. So we've got students from Saudi, from UAE, from Oman, from Qatar, from Lebanon, from Jordan on the program. And again, they're all working in the health systems in those countries. And then we've got a group from Malaysia and South Asia, etc. So yeah, Noor, living in Lebanon, job opportunities. I think, Noor, the word I used earlier, I think, was an MPH is the currency in public health. I think passport might be a better word. That a public health master's is the accepted base qualification that you have to work in any field of public health. So having a UK public health qualification will benefit you no matter what area of public health you want to go and work in. You could decide, right, I want to work in epidemiology or in research, or you could decide, actually, I want to do formal training as a public health consultant. It all depends on really what your individual career ambitions are, but the scope is huge. The Alamula, you can going through the brochure once again and contact for further details. The education advisors will be reaching out to you to answer any questions that you have about the program. And there will always be a series of questions as you make your mind up to come on the program. And it's highly unlikely we're going to have questions that we haven't been asked before and don't have the answer for. So we will absolutely we will absolutely guide you. The last question in there, the Royal Society of Public Health, I need to look into that actually. I don't have the answer off the top of my head. I would be stunned if it is not recognised by them as a, Warwick are one of the leading public health institutions in a university in the UK. So I would be very surprised, but very happy to get you the definitive answer on that. Any other questions? What else?
That's it, Dermot.
Yeah. No, yeah. And look, great to get all the questions.
And we have run over, so sorry guys, we said we'd try and keep us in the hour, and particularly sorry to those in the UAE who are on your national holiday today and should be celebrating. So thank you for taking time out of your very busy schedule to join us here today. You will be receiving the email with the recording of this event and the link to apply and the link to pay a deposit if you choose to progress your application. And thank you so much for your time. Thanks, Dermot. Thanks, Sadaf. Thanks, Mohammed. Thank you all for joining us.
Thank you so much, everyone.
Take care.
Bye-bye.
Bye.